Today, really the ground level, I mean, we are starting to understand the capabilities of these next generation or generative models. From a healthcare standpoint, our big responsibility is to make sure that, number one, it's aligned with what we care about, that it's safe for patients, that it's achieving the goal that it was intended to create. We worked on developing basically a to-do guide for investigators on, number one, how can AI actually help in ways that it previously may not have been immediately apparent for investigators to take advantage of the technology, these new models, and actually apply them to their own research questions. One of the big challenges people have is actually just saying, I have a data set, I have an idea, how can I take that and move it forward? Maybe traditionally find a biostatistician that can help at least get it off the ground, get a couple of collaborators together, and the process, just that process alone can take quite a bit of time. This wasn't going to turn into what we had initially thought, so why not accelerate all that? Using the tools that are now available to us, primarily in the generative AI space, large language models, and say, through a series of prompts, can we actually start doing that initial ideation? What does this idea look like? What's the methodology that might be good to address that problem? Let's do some testing together in collaboration with this AI model and actually get further along the way before starting to engage the collaborators, the expertise that may be necessary to get over the finish line. So have accelerated or move that timeline along more quickly, and we in this paper kind of show some guidelines and methodologies around how to actually achieve that. The other part of it is actually what's safe and important, and what do you absolutely need to do so that when you apply these tools, you're doing it rigorously, that it's safe, that it's valid, and again, providing some criteria around actually doing it, quote unquote, the right way. So yeah, this is the beginning, but unless we have clinical experts along the way as this technology develops, it's going to be really, in some ways dangerous without that pairing.